Hello, and thank you for joining us here at the First Alert Desk. I'm Maria Moreau. We are in the middle of the work week. A lot of us are just trying to get to the weekend, this beautiful fall-like weekend that we're expecting, and leading up to really Halloween and enjoying time with family. But we are still in Wednesday, and the focus for a lot of us is work. We want to help you bring down some work-related stress because turns out it can lead you to using up some of those sick days. And joining us today, of course, is clinical pharmacist James LaValle. He is also the author of Cracking the Metabolic Code. Dr. LaValle, thank you so much for joining us here today. You are going to teach me a lot about managing my stress, as well as some of our viewers, so I'm very excited to have you on here. So let's talk a little bit about understanding stress first and foremost. What is stress?
Yeah, sure. So stress is a normal reaction to when you go into fight or flight. The problem is that email messages and hanging onto your phone and traffic and, having your kids late for school, work stress, all of those things get interpreted by your nervous system as fight or flight. And what really starts to become the problem, and obviously we've all went through a very big chronic fight or flight response over the last few years with the pandemic. And so when your brain starts to interpret that you're continually in fight or flight response, that starts to create a change in the way your immune system functions and a change the way you respond to stress. Hormones change, craving patterns change, and it can really start to affect the way you feel. So stress is good. We need a stress response. It's just our body gets confused when we get the everyday stressors building up in us, and then it starts to overwhelm basically the circuitry of our nervous system.
And I got to read some of these stress markers, and I was thinking, oh my gosh, how often do I experience some of these symptoms? But let's go through them and really, how do they relate to stress, or how can stress cause these symptoms?
Sure. So, loss of focus and midday energy crashes and fatigue, for example. When your body continues to pump out a stress hormone, cortisol, it can start to disrupt the timing of when you're releasing these hormones. So your body's supposed to make a lot of stress hormones in the morning. It's supposed to go down midday and go down again in the evening, go down again at dinner. But what starts to happen is when we lose our body's ability to continue to generate energy, we can see these midday crashes that occur, and that's pretty common. Now, other things could cause that, like if you're eating a diet that's higher in sugar and you're crashing because, your blood sugar went up and now it's going down really hard. But it's that loss of focus that starts to occur too, because when you're under chronic stress, you start using up a lot of your brain's adrenaline and dopamine. And those are two neurotransmitters that are responsible for keeping you alert and being able to have you stay focused. So that's what can cause that. Now, the next one is really closely related to it. And a lot of people don't realize this, is that, how many people wake up in the middle of the night and think, oh yeah, I got to do that at work tomorrow? Or at 3 a.m., exactly, 3 a.m. wake up call. And that's because it turns out that insomnia is considered a disorder of hyperarousal. Your brain takes on too much stress during the day, and now instead of you having that decreased amount of stress hormones during the course of the day, now all of a sudden you still have too many of them. And when that happens, your brain can't switch to its nighttime behavior, which is to go into a rest mode, the release of melatonin, stopping the release of cortisol. And the melatonin helps your body go into what's called deep sleep and REM sleep, which is what restores your brain for the next morning. So you wake up alert and you don't need to stop at the local Starbucks in order to get that brain moving. You're resilient from a very good restful night. And so that's why that happens. And so people either have trouble going to sleep or staying asleep. And if you're a list maker, that's one of the key things. It's like, oh my gosh, I'm waking up in the middle of the night and I'm making a list. That means your brain is probably taking on too much stress. And then craving. If you think about it, you get home from work and, you go into the cabinet and you go, should I hug on the tortilla chip bag or should I hug on the bag of cookies? Because I love either one of them. And, it's almost as if you're eating those chips and you're going, man, that's real. I'm rubbing them right here. That's really feeling good to me. It turns out that when you get under stress, you have cravings for comfort food. And when I start to crave comfort food and then I start to overindulge, and all of us have seen that, right? Oh, I eat one cookie, that one cookie's good. I think I'm gonna have one more. And then after that second cookie, you go, well, I don't like even numbers. I think I want to have a third. And you actually even can go past being satisfied because you're eating to fulfill something to quiet your mind. And so that's how stress-related cravings for foods happen, is that you deplete your serotonin and dopamine, which is your feel-good neurotransmitters, and you're going to eat to try to get those to come back up. And so that's a biggie. And then, of course, the big one is when you start to recover poorly from exercise. And I'm sure a lot of folks that are listening have said, you know what, I'd love to exercise, but sometimes I feel worse if I exercise. Or I get sick more frequently than I used to. And that's one of the biggies is with chronic stress, you deplete your side of your immune system that makes natural killer cells and T killer cells. And so you're not able to fight things off as well. Acute stress works pretty good. Your body will work, with your immune system on acute stress, but that chronic stress wears you down. And we kind of saw that happen. During the pandemic, people that were more metabolically challenged, if they were overweight or they had diabetes or they had heart disease, their immune system was already kind of, already worn down. And then the stress of one, potentially, getting an infection, or two, just the stress of, socially what was going on could start to wear them down. And then, of course, the biggies that everybody's interested in, and I've been talking about this for years, is that, when you get stressed out, you gain weight. And a lot of people don't realize that weight gain can be related to stress. And you can even start to do things like lose hair. And so there's a lot of different things. People think, I'm not stressed. I don't need to go to my doctor and get an anxiety pill. But at the same time, you're always overcommitted. There's always one too many things going on in a day. Maybe your resting heart rate is in the 70s instead of the 60s, which tells you, you're a little jacked up. And so those are the key areas that, you may notice that relate to, was stress impacting my life or not? That doesn't necessarily mean you have anxiety, but it could mean that, that stress is taking its toll on you.
So it's less that stress gives you the cold and more that stress lowers your immune system, allowing things like the cold to tap into your body.
That's exactly right. Yeah, exactly. So as you're under chronic stress, your immune system kind of wears down, and now all of a sudden, you're getting sick more frequently. That's exactly right.
And let's talk a little bit about that. I think a lot of us, especially as we're talking about today, people are still at work, possibly on their lunch break or so. We all want to be good workers, and we all want to make sure that we're keeping up with our day so we can go to that weekend feeling fulfilled and like nothing's waiting for us on Monday. But oftentimes we wait till the weekend to give our body that de-stressing moment. How can people, be aware or cognizant that they need to be mindful of de-stressing throughout the week?
Well, yeah, you're bringing up a great question. So the first thing I would say is look at your blood pressure and look at your heart rate. Now, if you're wearing one of these smart watches, it's telling you what your resting heart rate is, and you can get a blood pressure very easy. Stop at any pharmacy. They've got those blood pressure cuffs you can sit at if you don't have one at home. But if your blood pressure is trending a little high and your heart rate, like I said, starts to be more in the 70s versus the low 60s, well, then that means your body's in excess sympathetic tone. And a couple of the things that you can do, like if you're at your lunch break, just take 3 minutes and do a breathing exercise. I call it box breathing. 4 seconds in, hold, 4 seconds out, hold. And on the exhale, think of the stress that you're releasing that you took on so far today. And then at the end of that little 3 minutes, just be grateful for something, because one of the biggest things people don't realize is that stress starts to affect your breathing. Once again, it's crazy that these little watches are telling us time to breathe. We should be thinking about breathing more than 12 times a day, right? It should be a normal rhythm. And when you breathe shallow, your heart rate goes up and you have more sympathetic tone, and that's going to mean that stress is getting the best of you.
So what do you say to people who go, well, Jim, I just have a stressful job. I've built up the tolerance to be stressed out?
Yeah, well, I say quit fooling yourself. Yeah, obviously take a look at labs. You can look at your cortisol level. You can look at your blood glucose levels, and you can see if it's playing out. And yeah, everybody's got a lot of stress. It's getting those strategies in. You don't have to go to the gym. Go out and take a walk, a brisk walk if you can. If it's not a half hour, it's 15 minutes, whatever. Do something that starts to say, I'm going to start to work around how do I manage the stress of my life? Because you know what? For most people, stress is a component in their life. And I'm a big proponent. It's like, look, you can use some key dietary supplements that can help you manage the metabolic inflammatory effects, which is now known as metaflammation in the clinical literature. They call it metabolic inflammation leads to aging or inflammatory aging. So a lot of people don't realize that, stress and not enough sleep are two of the biggest things that are going to accelerate that aging process. But more importantly, it kind of puts you in that funnel of swirling down towards chronic conditions and illnesses that, none of us want. We all want to be able to have the most vibrant life we can. So, that's when I talk to people about stress, it's let's be realistic about it. Where are you at with it? How are you feeling? Do you need to use some melatonin at bedtime to get sleep? Do you need some immune support because you're getting sick? I mean, there's a great Moducare. It's a plant sterol extract, fantastic for immune support because it basically modulates the immune system. It helps to balance the immune system. And I think a lot of times, people forget about that there could be some value in some nutrients that they could take if they're going to be under a stressful situation.
We're talking with Dr. LaValle. He's a clinical pharmacist, and he's here to remind you to breathe a little as you go through your work day to day. All right, so let's talk a little bit. You mentioned chronic illnesses. I want to talk a little bit about the long-term consequences of continued stress. Are past, the headaches, the weight gain, the hair loss, which are already serious problems, are there more complicated and long-term health issues that somebody could face?
Absolutely. So, two of our biggest issues in our country are heart disease and diabetes. And heart disease is clearly connected to stress. So when you make more stress hormones, your cholesterol goes up. And not only does your cholesterol go up, you make your immune system become more aggressive at attacking that cholesterol and making what's known as oxidized LDL cholesterol, which is kind of when you think of oxidation, you want to think of the rate of rusting in your body, right? So when that cholesterol rusts, that means you're making plaque. And the other thing that happens when you're under stress is your blood vessels get more stiff. And now you have to your heart has to pump that much harder to get blood through those blood vessels. And that's when your blood pressure goes up. And so heart disease, highly tied to stress. And in fact, your nervous system, the autonomic nervous system, the one that's running all the time, changes in that is actually the highest risk factor for the development of cardiovascular disease, more than smoking, more than other risk factors. And a lot of folks don't know that. They just think, oh, well, I don't smoke and I exercise, I'm normal weight, I'm not going to have any problem. And I can tell you that we regularly see people that may be normal weight, but their blood pressure is a little high, and now they're making bad cholesterol, and they're at risk. Diabetes is another one. When your cortisol goes high, your body says, keep blood sugar in the bloodstream so that you can fight that white tiger. So you can chronically build towards being insulin resistant or pre-diabetic. And why that's such a problem? Half of our population in the US is either pre-diabetic or a person with diabetes. And that creates a whole host of complications, everything from kidney disease to heart disease, peripheral vascular disorders, and of course, the obvious of when blood sugar goes high, it damages all your tissues. And so these are a couple really big things that happen. And guess what? For women in particular, because they're more sensitive to fight or flight, irritable bowel. So, you hear a lot of interest on irritable bowel syndrome or colitis or those kind of things. It turns out that anxiety and irritable bowel kind of can go hand in hand in many cases, particularly in women. So it really does affect a large portion of the population.
I'm sure you hear from a lot of your patients about some of the stress markers that they experience. I want to talk to you a little bit about the common misconceptions. Particularly, we respond to physical health, or physical health issues, I should say, seriously, but oftentimes that's not matched when we talk about mental health, and stress is often grouped with mental health. What are some misconceptions that you hear from people surrounding stress?
Yeah, I think that's one of the biggest misconceptions. Once again, people go, I'm not anxious. Hey, I don't need to take that anxiety drug. I'm not on anything for depression. But the reality is those medications are there when you've pushed so hard on that stress response that eventually your system breaks down and now you do need medicated. In my estimation, it's way better for you to start to work on those things so you don't have to get to that situation. Now, granted, you're going to have crises in life that may push you to that situation. And that's where medication may be needed, and that's fine. But for a lot of people, that it's kind of like the straw that's broken the camel's back. The actual term is allostatic load. All of a sudden, I push hard enough on my nervous system that now my brain starts communicating differently with my body. And one of the most important signs, I'm telling you, is blood pressure. And for example, there's great nutrients that can support that. Dr. Matt Budoff published a tremendous amount of literature on the use of aged garlic extract and its effect in humans on regressing coronary artery calcification, reducing blood pressure, and improving blood vessel integrity, in addition to helping a host of other benefits that occur, like peripheral circulation when you get under stress. So aged garlic extract, 900 publications on it. I mean, highly published, but yet a lot of people don't know about it. And so if they're looking for something like that, they should look up the research on Kyolic, Kyolic. Amazing stuff out of that natural area that could help people, because I think that biggest misconception is, as long as I can walk into work and do my job, stress isn't getting to me. And I would like people to think, am I creating a lifestyle that's going to promote my health and longevity as I'm aging? And can I feel good at the end of the week instead of going, oh God, I made it to the weekend, I'm going to sleep 12 hours and recover, right? That's where a lot of people end up at, instead of being able to enjoy themselves on the weekend and have energy and be able to go out and enjoy their life.
I have personally learned so much from this conversation, and I'm sure this is just scratching the surface of what you can teach all of us. Biggest takeaway that you want people to keep in mind as they're making it to their Friday?
Well, we're going into the holiday season, and the biggest thing I would say is grasp the joy of the holidays and the friendships and the family and the fact of giving or being of service, and enjoy it instead of allowing that stress of the season to kind of take it to that point of where you're feeling rushed and overwhelmed and overcommitted, and then utilize things like I mentioned, Magicare, aged garlic extract, or Kyolic. Think about those things chronically to help you as a preventative tool that can really help you to kind of manage your health as you're going through stressful events, as we all are. And the biggest thing is consider stress management a part of your lifestyle, not just something that needs to be done, once the wheels come off the cart.
It's like working out. You have to do it, and it's good for you. Just plan that into your day.
100%. That's exactly right.
Jim, I want to thank you so much. Of course, this full interview and more de-stressing and tips and things to watch out for as you're managing your stress are going to be on our website, atlantanewsfirst.com. Thank you.
Thanks for having me.